wonderful to sort of see you all online. My name is Rose Richards, Rosalina Rizale Richards Hessel, and I am your chair for this next session. I'm just, like many of us, fiddling with our lights down here in Dunedin. We are having snow showers and sun showers, so I've got various adjustable lighting situations because we're all Instagram models now, so enjoy that. I just want to say thank you to the organisers for making a Pacific space for us. All of us, Allamanda and Jane, are down here in the South Island, and particularly on cold days like this, we know we have to make our own Pacific space because we're a long way from the warmth of the islands. So thank you for making a virtual space for us to share some of our stories in this space as well. So first up, we have Dr. Allamanda Faatoese. Allamanda, I'll hand over to you if that's okay. Malo.
Malo apito, Rose. Malo apito. It's Tongan Language Week this week. But also talofa lava. My name is Allamanda Faatoese. I am a first generation New Zealand born Samoan, and I'm also a research fellow with the Christchurch Heart Institute. And today I'm just going to quickly share research that I'm involved with, and I'm absolutely blessed to be able to work with our Pacific communities here in the South. So as doing health research, particularly in these community spaces, it's almost like we have to walk between two worlds. And when we use our academic lens on how to do research, we have these frameworks that help us to answer the questions at hand. And also the one thing about research is actually that it's a very time constrained, financially constrained piece of work. And so when we're thinking about building relationships with our Pacifica communities in this instance, it actually goes against sort of the long-term relationships that our Pacifica communities hold. But when we have from a Pacific perspective, just acknowledging that the way that we view the world is in a holistic sense. And we have an amazing collective power, which is evidenced most recently by the efforts with the COVID response and also the measles response. So with those infectious disease, really epidemics and pandemics, there's been an amazing call to actually service the need for our Pacific communities. But it's a slower story for non-communicable diseases. Also too, acknowledging the fact that we have the term Pacific or Pacifica, and it actually is an umbrella term that represents over 20 different Pacific countries, each with their own different protocols, different languages, and also values and beliefs, and also experiences as well. Also too, and I think Peter Crampton mentioned this at the very beginning, there are absolute needs already on the ground which our communities are facing day to day. But at the end of the day, because our collective power likes to look after one another and to provide needs for the families within our communities, it also is a form of empowering our own collective in order to provide those needs. So for me as a Pacific, a Samoan, but also a researcher and a biomedical researcher, which I forgot to say at the beginning, is actually trying to get a balance between the two. Does the research question reflect what actually is happening in the community? Can it capture some of that complexity that our families are living with today? So my journey as a PhD student started off purely from a Western lens aspect. And again, this was just because that was how I was trained, and I'm sure many of us have had the same experience. So for me, As I said before, I work in the Christchurch Heart Institute, and all of our research is around trying to improve heart disease, whether that be from prevention right through to treatment at the clinical end. Speaking to the audience today, I probably don't need to say to you what the stats are for our Pacific people, but what I will say is that we've got a lot of work to do across the sector to ensure that actually our Pacific people are getting screened for cardiovascular disease and its risk factors, that the treatments are appropriate at the right time, that even when they go through to the hospital system, that they also receive the right care at the right time. But as well as that, ensuring that our workforce can also be trusted by our Pacific communities. At the same time, we also have, as you can see on the slide here, a plethora of amazing research that's already been done on cardiovascular risk factors in the community. And this is largely by our University of Auckland counterparts. And I know that within institutions, we also can become quite siloed as well. But I think with our Pacifica community across New Zealand, we're too small a population to be working individually. However, again, just acknowledging all the amazing work that's been done by researchers across the country trying to address the disparities of cardiovascular risk factors for our Pacific communities. And a lot of this work has been done up north, which is where really the Pacific population is a lot more density of our Pacific population in the North Island. But what about our South Island Pacific counterparts? So currently we have about 8% of the total New Zealand population living in the South Island. But the research that has been done in Auckland or in the North Island centres, does that also apply to our South Island, for our Pacifica populations living in the South Island? And the other thing too, I need to note as well, even though we're a small population in the South Island, we are a rapidly growing population also, and not just in the urban centres, but also amongst our rural centres as well across the South Island. So this gap in knowledge, we felt needed to be filled. And thanks to our funders down below, HRC Heart Foundation and also Lotteries and Research Grant Board, we managed to get some funding to actually address the first question, which was actually what are the risk factor profiles or cardiovascular risk factor profiles for people in the South Island? And then with the expertise within the Christchurch Heart Institute, can we also look at other biomarkers and see if they're associated with cardiovascular risk in our Pacific peoples? So this slide just shows really the three aims of that study. The last aim, which was looking at lifestyle risk factors with a focus on nutrition, was added in later, and I will talk about that further on. This is really just what we did for the Pacifica Heart Study. We managed to, it was a one visit. So we saw our participants in clinic, and I should say we partnered up with the Pacific Trust Canterbury, which were a Pacific health provider. They're now E2 Pacifica, but they have a GP clinic, which is quite unique in the South Island. I think it's the only GP clinic that's under a Pacific health provider. And so we approached their Pacific participants who were aged between 20 and 64 years of age. We tried to aim for getting a representative sample of the population within Christchurch, and I mean by age. And we actually had a really difficult time trying to recruit the younger ages. And so in the end, we ended up just settling for getting whoever we could get through the door. And again, all of the data that we collected was quite rich through the questionnaires, but also looking at biomarkers as well, which was quite unique in this study, which I think hasn't been done in some of the other research solely looking at risk factors. So from that, we had two particular biomarkers of interest, which are now both under HRC research funding to carry through. And I will talk about, also the first one was NT-proBNP. This is a heart hormone, which is a marker of cardiac stress. Is currently used in clinic to diagnose and in the treatment of heart failure. But also too, what we noticed was when we measured it in our Pacifica study, heart study, the levels of NT-proBNP were significantly lower than other levels of other community-based studies within our wider research group. We looked at, also too, we looked at our Māori cohorts that we had as well, the community ones, and we didn't see any difference between Māori and our European cohorts, but Pacifica in our community study were quite low. And people would probably think, well, it's a community study, there's probably very lower levels of heart disease. So we also then looked at actually people with heart failure, and we noticed the same difference in NT-proBNP levels in Pacifica with heart failure. And subsequently, there's another group that have also looked at and seen the same effect in those with first-time acute coronary syndrome. So this HRC project for NT-proBNP addresses, we hypothesize that actually for the gold standard test, that there is something on the NT-proBNP molecule that is preventing it from being detected. And this, we hypothesize that it's a type of a sugar, a glycosylation sugar. So our research team, which is down in the bottom left corner, are going to basically strip off the glycosylation sugars and then retest it, and then see whether levels increase. And if that does, then that could possibly have quite significant clinical impact for interpreting NT-proBNP amongst, or interpreting NT-proBNP levels amongst Pacifica patients. The second biomarker of interest is vitamin C. So we were fortunate enough to collaborate with Anitra Carr, who's pictured below. She works in free radicals research group here at Christchurch campus, and her main interest is in vitamin C in health. So we know sort of in general terms that vitamin C is good for health. We know biologically it's used, it acts as a cofactor for enzymatic reactions, and one of particular interest is associated with increased risk of heart disease. So the lower the levels of vitamin C, then the increased risk of particular lipid pathway is exacerbated and then can lead to coronary disease events. But we also know with vitamin C that humans cannot synthesize vitamin C. We actually only get it by consuming vitamin C rich fruits and vegetables. And so this is one study which we'll just go on to talk about from the original Pacifica Heart study. So what we found in the Pacifica Heart study when we did the food frequency questionnaires was we asked our participants, you know, how much fruit and veggies do you have? And we know sort of the public health message around the 5+ a day fruit and veggies is what we should be aiming for daily. In our particular cohort of 200, we had people, both males and females, per day, averaging about 2 serves of fruit a day. And this is all self-reported, but the vegetables, which should be aiming for around about 3, was just over 1 serve per day. So already there, we know that even currently, the attaining to sort of the public health message of 5+ a day for good health really isn't reached by our cohort. What we do know as well, though, which I haven't put in this presentation, is that when there were the nutrition, New Zealand nutrition surveys around, they're no longer being performed, that they also showed similar data that actually fruit vegetable consumption was fairly low in our Pacific communities. However, the story goes on. We were able to measure vitamin C status from blood samples. And as you can see here in the table, that there are sort of 4 different states of having vitamin C. A recommended threshold for, or concentration of vitamin C is anything greater than 50 micromolar. And we only had about 8% of our cohort actually meet that threshold. And so the rest, about 91%, had inadequate. Of concern were people who had, or those who had measured levels that were in hypovitaminosis C, but also deficient, so levels that were lower than 11 micromolar. So those deficient ones with deficient vitamin C levels could be termed similar to what scurvy is defined as. So having these particular findings jumping out from the Pacifica Heart Study actually then got us thinking about, well, actually, how can we educate and how can we provide our Pacifica communities with, the importance of healthy eating, not just for overall health, but hopefully would also impact on better cardiovascular health, better metabolic health at the same time. So this particular would put together a pilot intervention program. This was actually in collaboration with Pegasus Health, which are our PHO in Canterbury. They already run community nutrition education programs, which and they were wanting to be able to deliver to our Māori and our Pacifica communities, but looking at their existing programs which are delivered to mainstream, it was not relevant. It was information heavy, and again, thinking about what is the uptake of our Pacific communities for this information, it just needed to be redone and retailored. So they did, but I should say Malia Loto was the title of this project. It's actually Samoan for a satisfied soul and a happy heart. So from the research question, we were also interested in the epigenetic factors. So this is where environmental factors impact on the genetic structure and of your DNA, and the way that depending on where those markers sit can actually change how the DNA folds and then changes protein expression as well. So, but also too, at the same time, these environmental markers on the DNA can be transient. And we know that from a lot of international literature that smoking is a really good example of that, where if you're a current smoker, you have a particular epigenetic profile that actually then leads on to proteins that are expressed in inflammatory pathways. And then once people stop smoking, that changes again. And the protein pathways that result from that are ones that are around regeneration and all the good pathways related to enabling good health biologically. So we teamed up with Pegasus, as I've said before, but we also wanted to be able to team up with other community agencies. In Canterbury, we have a fruit and veggie cooperative who provide affordable fruit and vegetable packages for the community. And so we the methodology of this particular pilot project is that we do 12 weeks with our people, and we provide them with 12 weeks of fruit and veggies, just to let them know what's out there. Because once we come in and do a research project, we're there for 12 weeks and then we leave. But hopefully we leave with them knowing, one, about nutrition, but two, about sort of what's out there in the community that can actually enable them to be able to continue on with the learnings that they've been a part of. So kind of putting on those lenses again, the research question I've said before, the research framework, we actually wanted to recruit 50 Pacific women initially, aged 30 to 55 years, because we're thinking about our epigenetic analysis here. Also doing pre and post intervention measures. And again, we don't have a control cohort, so we've actually made themselves their own control, which in a statistical sense works well. And again, this is a pilot study, so the intention is to hopefully make it a wider one and see whether this also works in other centres as well. And also too, that our sessions are held in the community. One thing I'm very mindful of is actually ensuring the accessibility of our research to our communities. So we negotiate times and venues that are accessible to everybody. And as similarly with the Pacifica Heart Study, having to work in and around normal working hours. But that's what we need to do to be able to ensure that they also have a say in the research. Looking at the Pacific lens, we were sort of our talking with our communities and stakeholders. They wanted us to actually widen our recruitment to include men, but also the younger and older ages, taking into account that actually our Pacifica households can actually have multi-generational members, but also multi-families. So there'll be some people having more than one family living within one household. Different cultural protocols, and ensuring that we try to reach out to, as I've said before, very diverse Pacific Island groups. The needs, a lot of commentary was around it's too expensive to be eating healthy for our family, and I totally understand that. Hence why we tried to find options for them. One, that we made it easy for everyone. So we, as a research group, provided them would provide our research participants with fruit and veggies to enable what they've practiced. But also, too, again, is trying to expose them to what's around in the community that is not in a supermarket, which it is quite expensive. Empowering, again, I think someone mentioned this before. Practical skills really are what our people love to learn about. What can they do in their own households, in their families? And this program, which had been tailored for our Pacific audience, we've started recruiting, seems to be working at the moment. Also having relevant resources there but also acknowledging the language. There may be some people with limited English through to those who are quite fluent in English. So having relevant resources to give to them. And also, just leaving. So once we've finished the 12 weeks, as researchers, we walk away, but what do we leave with them really is so that they can then sort of continue on. And so again, for us, we thought it was actually just giving them the option to be aware of what's already in community. And I think for a community project, it's really important to be able to do that. So, and I know sort of a lot of the research that's been talked about before is all quite kind of big. And I often ask myself, is the work that we do, or the work that I do, going to be a change maker? Is it going to provide evidence for policy? Completely unsure about this, but it actually will contribute to evidence for change, I think. We've got a lot of work to do on the ground, and I think for me, working in the community, which is where I I love working with our Pacific communities. Hopefully that we can answer, one, our research questions, but actually ensuring that at the same time our connection with our relationship with our communities is also of benefit to them too. Is there impact for communities nationwide? Again, we're not too sure. We would hope that it would. Again, this is just a pilot for this particular nutrition intervention study. Well, does it have impact on families? I can definitely say yes, from what we've seen so far, is that our families, when we're doing this particular kind of research, we actually invite everybody within the household to come in, and we take measures of our research participants. But we have actually seen engagement from the children of the families who come in, but also from the matua, the grandparents, who also come in as well. So it's been an absolute blessing to be able to work in this space and continue to work in this space as well. So I think that's me for now. I will leave it there. Malo aupito, and thank you for a wonderful day.
I feel like I want to clap, but that's weird online. Thank you so much, Allamanda. I love the story of your journey into this space as well, because I think that's really useful for people knowing about people's journeys into a research environment. That mix of generosity of our communities and our worldviews and the constraints of our research life. And I think it was beautifully summed up in the contrast between the academic title of epigenetics of cardiovascular, etc., versus the feeding your soul. We're trying to do the same thing, but it's a much bigger picture. So thank you so much for that. That was awesome. So we're going to move slightly further down the country, and we do have some opportunities to ask questions in the question and answer space, and we might have some time at the end as well. And I'm sure Allamanda and Jane as well would be happy to connect with you offline as well. So let me introduce Jane Taafaki, one of our awesome Oamaruvians. Is that a thing, Jane? And part of our growing Tuvaluan community down here in the south and in Oamaru in particular. So wonderful to have you here, and I'll hand over to you.
Thank you, and good afternoon, everybody. Talofa, I'm very humbled to be in this space with all of you today, and I would really like to thank the organizers of this conference for putting me after Allamanda. I've got some very big shoes to fill. So thank you all. I'm just going to share my screen now so that I can do my presentation. So talofa again. My name is Jane Taafaki, and I'm with the University of Otago in Dunedin. Talofa katoa koutou, whakatailasi ko maua te awanoanga o tuatu mai mua nei. Tulo te malu o koutou katoa, tulo. Toki ngoa ko Jane Taafaki, toko matua ko Paleliva mo Irene. Toko matua ne vau mai Ngalani mo toko tamana ne vau mai whenua no whetau mo whanau futi I roto Tuvalu. Taku awanga ko Tony e toko tolu mātama whawhine ko Sophia Sierra mo Poima. E langona te lotu whono I te whiawhia ona ko maua te awanoanga ki tuatua o whakaako atu se whekau whaoliki mai konei. Whakawhtai lasi. I'm very humbled to be with you all today. I would like to thank the University School of Medicine, my scholarship, the Pacific Island Doctoral Scholarship, my department, the Preventive and Social Medicine, Va'o Tautai for their continued support of me, and three of the best supervisors anyone could ask for, Dr. Sligo, Dr. Richards, and Dr. Gold, and the Tuvalu communities in Oamaru and Dunedin. And just one quick note, in the program, I am listed as Dr. Jane Taafaki, which is really nice, but I'm not quite there yet. So thank you for jumping ahead, organizers, but I am yet a humble PhD student. So a little bit of background for those of you who don't know. I know that many of those listening in today are quite familiar with Pasifika population in New Zealand. However, just as a little recap, currently Pasifika number about 400,000 in New Zealand, and that is projected to go well over 650,000 over the next 20 years. Most people think that that's quite a low estimate. We are predominantly Auckland-based. However, in-country migration to the South Island has been gaining popularity, especially to Otago. And Pasifika are lured here generally by a lower cost of living and very well-paying jobs in the freezing works and the dairy industry. So in Oamaru, where my project is based, Pasifika represent about 20% of the local population. We are predominantly Tongan, Samoan, Tuvaluan, and Fijian. So out of the about 4,000 Tuvaluans who began migrating to New Zealand in the 1970s, we have almost 200 Tuvaluans here in Oamaru. And the status of Tuvaluans in southern New Zealand really is a very unexplored area of public health research, which is why I'm hoping that this particular study will contribute to a body of study of Tangata Pasifika in New Zealand and make a positive contribution to the improved health outcomes, not only of Tuvaluans, but also by extension, Pasifika peoples in the New Zealand diaspora. So some background for Pasifika health, we do tend to face quite a lot of challenges when it comes to our health, and we have a continued rise in the incidence and impact of chronic disease, higher rates of obesity and smoking, utilization of the ED, late stage diagnosis, challenges with health literacy, and particularly south of Christchurch, limited access to culturally appropriate care. So my particular project here in Oamaru involves our Tuvaluan community. And being that Tuvaluans represent a small and relatively new Pasifika population to New Zealand, there is very much a lack of knowledge about their health and health experiences in their new chosen home. So my project seeks to explore the lived experiences of New Zealand Tuvaluans who are currently navigating the New Zealand healthcare systems, and then the ways in which they interact with various aspects of that system, and to explore their overarching experiences related to their health. These are the questions that are being asked through the project. What are Tuvaluan experiences in primary care, with tertiary care, looking at issues relating to access and their successes, their failures, the barriers that they're facing, and then doing a comparison between recent versus long-term Tuvaluan residents in both rural and urban New Zealand. I'm also looking at the current government and systemic or structural policies that impact the health and well-being of Tuvaluans, and then looking for recommendations for change that can be made to improve their health and well-being. The project is a community-based one. It is allowing me to combine my Pacific values with meaningful engagement with my participants. The process that I'm using, the method that I'm using is photo voice, which partners very well with CBPR because both are action-oriented, community-driven, and the emphasis really is on the collaboration between myself and the community, and allows for personal and community level action that will result in positive change, and the change to be more inclusive, to be empowering, to be more effective through the use of photo voice. And for those of you who are unfamiliar, photo voice is a method in which photographs are used as a teaching tool to display both explicit and unseen aspects of their lives in their community space. So when trying to capture somebody's lived experience, they can tell us their story through the images that they choose to take around the themes that we collaboratively create. So ultimately, the purpose of the study is to inform and affect change. And one of the things that Allamanda said in her previous presentation is that although we cannot guarantee policy level changes, studies like mine hopefully will be able to contribute to a body of knowledge that will inform and contribute to policy change down the road. So I'm hoping that the results of this research project will culminate in positive health outcomes for Tuvaluans and other tangata Pasifika in southern New Zealand. And rural healthcare for Pasifika is a generally new concept and on the research map. So, very much at the beginning, early stages of creating this body of evidence to inform and affect change. So I began this project in October 2019, which is when I first arrived in New Zealand and began building my relationships with the Tuvaluan community here. Data collection began in earnest in January of this year with my first reflection group. I am now with my second reflection group, and out of a total of 4. So I have working on 2 female groups. I will have a male group, and then I will end with a youth group. All of the sessions are via Talanoa, and they're roughly a couple of hours long, depending on how long we chat for. And as with almost all community-based projects, they don't work on the researcher timeline. You very much have to go along with how the pace that your community wants to go at. So lots of lessons being learned there in terms of patience and flexibility. I have been very pleasantly surprised as how the sessions have turned into informational and advocacy spaces for the participants. And our Talanoa really has no time limit because it's gone beyond the sessions that we've been having into conversations outside of kindy, in the supermarket, random chatting. It's really become a very organic process, and so it's been exciting in that way. And I've enjoyed every part of it so far. That's all I have to share with you this morning about my project. I'm happy to answer any questions that you may have related to the project up here in Oamaru. Thank you.
Mahalo, Jane. Thank you so much for that little discussion of where you're up to, what you're doing, and acknowledging all of the exciting aspects and timeline of working so closely with your community. And I imagine having the interesting lockdown situation, there were many people who have a lot of sympathy for you and your PhD journey and the excitement of that. And also acknowledging for our Pacifica communities that when it comes to things like testing, when it comes to things like vaccinations, then a lot of people like yourself are being drawn into those front lines of making sure that in this very urgent time, our communities are being linked with. What I might do, I'm just looking at our questions and answers. We do have a question for you, Allamanda, around duration of the program and plans for evaluating the cohort. Do you want to speak to that? Would that be okay?
Yeah, sure. So what was the first plans for the program or the duration of the program? So duration of the program, so at the moment, so it's 12 weeks per, we spend 12 weeks with each community group. And actually that community group could be either family or church at the moment, which is what I've found has been sort of the reach out towards being involved in the project. The evaluation, we do two things. So partnering up with the Pegasus Health, they have an external evaluation form about how well it's done, but also so we're going to rely on sort of the delivery of the program evaluation through that aspect from their evaluation questions. But at the same time, we are also in the research space evaluating what our participants thought of the research project themselves. And that's you doing just very small focus groups to capture their stories, their experiences from being involved in the research project. And 12 weeks does sound like a long time, and I should say it's delivered by a Pacific person, i.e. myself, and a colleague, a Māori colleague, because of really, we actually have very little capacity. However, we rely on sort of our own efforts currently at the moment. So we're doing some little focus groups just to capture their experiences, and so far just amazing stories. And I think really just 3 months goes by very quickly when you're working with our communities. Yeah.
Wonderful. Thank you, Allamanda. And I think a really interesting element of any research program to be asking how was that for you? And we can build on that as researchers as well, because we're still trying to figure out our measures, our way of operating in this space, how we walk in those spaces between, as you showed in your picture. So that seems to me to be an important part. Apologies, I think I was meant to read out the question, so I kind of gave you some clues, Allamanda, but I'll read your one out, Jane. And it's in particular around Tuvalu and climate change and rising sea levels for your community in the region. And the specific question is around, do you predict that the population of tangata Tuvalu to increase in Aotearoa, and what kind of support should we be putting in place for our families who are potentially coming here?
That's a really good question. Interestingly enough, when you speak with Tuvaluans here in New Zealand, climate change really isn't forefront in their minds. And Tuvaluans are, like other Pasifika migrant communities, very much restricted by what New Zealand immigration allows. So Tuvaluans do come under the Pacific Access category, which allows only 40 Tuvaluans to come here every year under that category if they qualify. And the qualifiers can be quite difficult, and the income limits are quite high, and the same for permanent residency. So right now, the biggest pathway for Tuvaluans into New Zealand is through the seasonal worker scheme. And which has kind of, been thrown into somewhat of a disarray over the last couple of years because of COVID. At the moment, climate-induced migration to New Zealand, for Tuvaluans at least, is not what's the correct term? There aren't any. Is that clear? Clear enough? At the moment, first of all, New Zealand doesn't recognize climate refugees. And on the other hand, there is not a flood of movement out of Tuvalu because of climate change. We're a highly resilient people, and unless the mechanism is there for us to move, we're not moving. So right now, people are still very much engaged in the modes of migration that they have been for the last 5 to 10 years, either through the Pacific Access Scheme or as a seasonal worker. And then the families that are here, we're into our 3rd and 4th generations of families. And I think the biggest really answer to that question is that people are not repatriating to Tuvalu. And part of the reason that they're not repatriating to Tuvalu could be attributed to projected climate change issues. But at the moment, the numbers of Tuvaluans leaving Tuvalu for New Zealand are very, very low, mostly because of restrictions on immigration that make it hard for Tuvaluans to migrate here. It's not an easy process, and it is quite economically restrictive. So to answer your question, no, I don't expect that number to go up exponentially anytime soon, unless there's some sort of a natural disaster that suddenly opens doors to New Zealand that weren't open before.
Thank you so much, Jane, and thank you both, Jane and Allamanda, for repping the South Island Pacific community today. A special mention to Jane also for repping our rural Pacific community.
Mm-hmm.
I think when I came on, Dr. Perry was talking about intersectionality and the challenges around being in health groups who don't necessarily have the services that they need in rurality, and also our Pacific community. And also, you know, our migrant communities who are managing those visa issues, as well as trying to access care and some of the challenges around that. So much to do, and also to unpack the intersections of those spaces. So thank you so much. I think you guys have a break now for 30 minutes.